Good afternoon, everyone. My name is Andrea MacLean, and I'm the Director of Interoperability Standards here at Canada Health Infoway. And it's my absolute pleasure to be part of partnership again this year. My presentation today is entitled Many Voices, One Direction, and I'm really hoping that by the end of the presentation, you'll very much agree with me in terms of the idea that there are many voices, everybody moving things in one direction, standardization of standards. Before I begin, however, I would like to start with a land acknowledgement. We acknowledge that the lands on which we are hosting this meeting include the traditional territories of many nations. Canada Health Infoway recognizes that the many injustices experienced by Indigenous peoples of what we now call Canada continue to affect their health and well-being. Canada Health Infoway respects that Indigenous peoples have rich cultural and traditional practices that have been known to improve health outcomes. I invite all attendees to reflect on the territories you're calling in from as we commit ourselves to gaining knowledge, forging new culturally safe relationships, and contributing to reconciliation. The agenda for today, I thought I would just give you a little bit of an overview about the National Release Centre for Digital Health Standards here at Canada Health Infoway. And then I hope you'll indulge me as I pivot to talk about the work that everyone at a pan-Canadian level is working on together. And I'm hoping that by the end of my presentation, you'll be eager and excited to learn more and to get involved and to contribute your talents and expertise to this very important work. Before I dive in, I thought that perhaps I should start at the very beginning and just ensure that we're all starting from the same point of reference. We use the word standards a lot, and depending upon the context, the word standard can mean different things to different people. Just like an electrical engineer is not the same as a civil engineer, a content standard is not the same as an exchange standard. Content standards organize clinical information, and we see this representation in forms, in documentations, clinical guidelines, and templates as examples. And these are often referred to as data standards as well, if you hear that out and about in the community. Terminology standards are structured clinical vocabularies that use terms and codes to represent and encode clinical concepts or ideas. Examples of terminology standards are the Canadian edition of SNOMED-CT that may be used to convey information about an allergy or an intolerance as an example, or LOINC that's used to convey information about a fasting glucose as an example. Terminology standards are used to ensure that the information collected is shared and is understandable, reproducible, and usable. This is also known as semantic interoperability, and these standards ensure that the information that is being communicated is communicated in the appropriate context of which it was collected. Exchange standards are digital instructions for how to exchange health information from one system to another. Examples of exchange standards are HL7 version 2, HL7 version 3, HL7 CDA, and FHIR. When used together, they set expectations about how and what data will be shared in a standardized manner in the appropriate clinical context. Standards enable our health and care information to be used and reused to support informed decision-making, informed clinical care guidelines, and to help ensure that the best practices are relevant, leveraged, and evolve as both the lives of medicine and Canadians evolve. Without standards and a standardized approach to implementation, data is unusable. And this has a very real cost to the well-being of Canadians and our healthcare system. For those of you that may be new to standards, Canada Health Infoway is proud to be home to many pan-Canadian standards. We are true to Canadian guiding principles of adopting or adapting international standards. And as such, we are home to the Canadian edition of SNOMED-CT, the Pan-Canadian constraint of LOINC, known as the PCLOCD, and home to HL7 Canada and IEG Canada. We're proud to provide Secretariat support to ISO TC215 and to help facilitate the voice of the diagnostic imaging community with DICOM International. In all of this work, we strive to bring Canada's varied voices and experiences to the various international standards development organizations to influence the development and the evolution of digital health standard information. We do this by connecting and convening and galvanizing stakeholders to work together towards a standardized pan-Canadian approach. We share knowledge and lessons learned, and we provide access to these various standards and tools, all with the goal of improving data quality, data use, and reuse that enables and supports health systems to provide a better and more connected experience with the patient as the focus. In partnership, we strive to support the accessibility of quality information to the right people at the right place at the right time. 2020-21 was a very busy year for all of us involved in this standards work as we worked to support those that are working on the front line and doing digital health implementations. We had over 1,300 questions and requests for assistance that submitted to our standards box. Between SNOMED, CT, LOINC, and the PanCanadian subsets, we authored, published, and maintained approximately 2,300 changes to our PanCanadian standards. These requests for change were submitted to us by various organizations, provinces, and territories, and organizations such as CIHI, the Public Health Agency of Canada, Immunize, and various vendors. We had approximately 47,000 downloads of the PanCanadian standards, and we saw a steady growth in the use of HL7 Fire as the newest exchange standard on the block. Along with our regularly maintained releases of our PanCanadian standards, we offer a variety of additional services and tools that are all accessible via our collaboration hub known as InfoCentral. Access to InfoCentral is free, and each year we ask our clients upon login to accept the license agreements and the terms of use associated with the various standards, services, and tools. From InfoCentral, one can join a community and exchange information, ask a question, learn more from each other, and engage with Infoway subject matter experts. You can access tools to support exchange standards such as the Canadian Fire Registry, or you can browse the latest version of PCLOCD in the Terminology Gateway. Via InfoCentral, one can browse Pan-Canadian and provincial territorial subsets in the Terminology Gateway, access the Fire Terminology API service, or request to add content to any of our Pan-Canadian standards. We like to think of InfoCentral as our single source for access to all of our standards, services, products, and tools. So now I'm hoping you know a little bit more about what we do, and I'm thinking maybe your next question is, well, how do I access these standards? Is there a release schedule? How do I request a change? Again, the answer is InfoCentral. On InfoCentral, you'll find information about each of our Pan-Canadian standards. The pages are all organized the same, and we've tried to make the section headers action-oriented, as people will often say, how do I download the latest version of SNOMED CT? Or how do I join a community? How do I learn more? We also publish our release schedule on InfoCentral, so you will always know when the next release is coming to help you with the planning of your implementation. And at any time, you can request a change to any of our Pan-Canadian standards, also via InfoCentral, through a tool there known as Informs, the Infoway request management system. You know, lots of the questions that I seem to get lately are, who are actually using these standards and who contributes to them? And, you know, I like to let people know that Infoway is part of a larger standards ecosystem made up of a number of stakeholders who each have a role in the development, management, maintenance, and implementation of standards in Canada. Everyone shown here on this slide is, and more, is a user and a contributor to our Pan-Canadian standards. Our clients and partners include standards to health development organizations such as SNOMED International, IHE International, HL7 International. It includes our provincial territorial partners such as Ontario Health, BC Ministry of Health, Alberta Health Services, and others. It includes the Public Health Agency of Canada, Health Canada, and of course, the many vendors in our vendor community. Together, we make sure that standards are developed and maintained to meet our ever-evolving health and care needs. You also may be wondering whether or not the terminology standards are available in French, as we are an officially bilingual country, and Infoway is very proud to provide the French translations of the Canadian edition of SNOMED CT and PCLOCD in partnership once again with our provinces, territories, and our sister agency, the Canadian Institute for Health Information, and others. We also participate in international translation of SNOMED CT, and we're pleased to work with France, Belgium, Switzerland, and Luxembourg to provide semantically correct French translations of this content. It's important to note that the translations are not complete translations of the entire terminology. Rather, we take our lead from our requesters to ensure that the content most needed is translated first and semantically sound. A translation is not a word-for-word translation. It is a translation of the semantics of the concept that we are trying to represent. And we'd like to thank everyone that's involved in the work, as it really is a team effort. So I'm going to change gears now, and as promised from the title of my presentation, I'd like to spend the rest of my time highlighting the great work of so many other voices coming together to contribute to our goal of the right information being available at the right time and in the right place. I'm going to start first with our public health surveillance community and the topic of immunization. We were pleased to have worked this year with Health Canada, the Public Health Agency of Canada, Can Immunize, and all of our provincial territorial partners to add all of the WHO or World Health Organization and Health Canada approved vaccines to the Canadian edition of STEM-CT via our public health surveillance community on InfoCentral. This information was paramount to getting vaccines safely in arms. It enabled public health agencies to successfully track the administration of these vaccines and to follow up on any adverse events following immunization. And the same information is now being used to demonstrate proof of vaccination in various vaccine certificates. We're grateful to Health Canada and all of our partners for helping us to get access to the vaccine experts required to ensure that the vaccine content was appropriately modeled to ensure that when this information is captured and used, we are placing patients first and their safety first. Similarly, we were pleased to work with provincial territorial partners and the Regan Street Institute to be able to add new diagnostic tests for COVID-19 to LOINC PCLCD to support the testing and diagnosis of this illness. As our knowledge of the virus grew, new concepts were added to detect each of the new variants of COVID-19. These LOINC and PCLCD codes have enabled e-health agencies like Ontario Health in this example to make lab results available online from any device, anywhere, anytime. Having access to information like this at our fingertips is a real difference maker in our quest to return to the new normal. As I said at the beginning of this presentation, we need all of our standards to work together: content, terminology, and exchange. The HL7 Canada Fire Implementers Working Group has been working to construct the Canadian Fire Baseline. On the screen here are some screenshots of the patient, the observation, and the immunization fire profiles. This working group has been working to contextualize the base HL7 international fire resources for use in Canada, with the idea being that if you need to build an exchange standard using fire, one would start with these Canadianized resources. The work continues and is accessible via InfoCentral, with conversations ranging from the base resources themselves to defining processes related to updates, versioning, and maturity models. One of the projects that I'm most proud to see on InfoCentral is the work being done by many to reimagine and redefine how sex and gender information is collected, captured, and shared in our electronic health systems. People who identify as sex and gender minorities in Canada experience numerous health inequities, and many of the electronic systems in use today are often unable to capture gender, sex, and sexual orientation data beyond a single data field. This team analyzed how sex, gender, and sexual orientation information is captured in Canada. And as you can see from the slide, there are no less than 7 code systems or terminologies with various values or codes being used to capture this information. We see the words male and female, the letters M and F, and numbers like 1 and 2 all being used to capture the same information. This older way of doing things is not reusable. It's not really usable. It's certainly not understandable outside of the system that's receiving it, nor is it reproducible. But most importantly, it is now known to be harmful because it excludes people who do not identify with a binary sex or gender construct. To do this work, this group of dedicated multidisciplinary professionals meets monthly and shares offline review findings while seeking input from the larger sex and gender working group and the Pan-Canadian health terminologies community. Together, they're identifying all of the existing sex and gender concepts in STEM-SCT and compiling a list of proposed new, revised concepts and looking at concepts that should be modernized in the terminology. Once consensus has been reached, the list of proposed changes to STEM-SCT will be submitted to Canada Health Infoway for us to process accordingly in either the international or the Canadian edition of STEM-SCT. The goal of this work is to publish updated sex and gender subsets for implementation, and work on sexual orientation will follow soon after. We know that terminology standards need to be used with the exchange standards, as I said earlier. And to that end, Canada has been working closely with HL7 International and DICOM International, SNOMED International, and others. And there's now work underway at the HL7 Gender Harmony Project to update those older versions of version 2, 3, CDA, and FIRE to support the modernization of our exchange standards related to this work. We know from experience that resolving the standards portion of a clinical problem is an important part of the solution, but more is required. A 7-point action plan was developed with the support of Infoway, CIHI, CHIMA, the Canadian Institute for Health Research, and other partners over the course of 2020. In 2021, this group is now working on knowledge translation via the Michael Smith Foundation for Health Research REACH grant, which was awarded to the University of Victoria Gender, Sex, and Sexual Orientation Research Team. This work continues to be supported by InfoCentral, Infoway, CIHI, CHIMA, and others. The overarching aim is to modernize gender, sex, and sexual orientation information practices to enable the support and culturally safe, equity-oriented Canadian healthcare for sex and gender minorities. The full action plan in both English and French can be found on InfoCentral in the Sex and Gender Working Group, and all are welcome to participate, as we're not done yet. I'm hoping that by now you are as excited and as proud of all this work as I am, and I hope that you're eager to roll up your sleeves and to join us. To learn more about any of the communities or working groups described here, or to access or implement any of the Pan-Canadian standards, or to seek further information on anything that you may need to support this work, you need look no further than InfoCentral. Please don't hesitate to reach out and contact us. As I said earlier, if you have any questions at all, we can be reached at standards@infoway-inforoute.ca. Thank you.